Welcome back to TRADOC Talks, the podcast for TRADOC Command information. I'm joined once again by Colonel Chris Meyering, the TRADOC Command Surgeon, and he's here with some updates on how to stay safe from the coronavirus. Colonel, welcome.
Yeah, thank you very much. I appreciate the chance to get to talk with everyone again. Today, what I really want to focus on is some of the things that you've probably been seeing in the media with social distancing, and then share just a couple of different updates on some new developments, for the disease, the COVID-19. So just to recap, so COVID is thought to be spread mainly from person to person, and then so that's people who are in close contact with one another and about within a 6-foot distance, and it's spread through respiratory droplets that are produced when an infected person coughs or sneezes. And then those droplets can land in the mouth, nose, or even the eyes of the people who are nearby, or possibly inhaled into the lungs. Also possible is somebody can get the disease by touching a surface or object that has the virus on it and then touching their own mouth or nose, or possibly even the eyes. So just think, if you go out shopping, as an example, and you grab a cart, you just have to assume that the virus would be on that handle. But also remember, this is not thought to be the main way that the virus spreads, and it's mostly through infection when somebody coughs or sneezes. So really, the social distancing means staying out of situations where there's an increased chance of person-to-person spread. And so avoiding large gatherings of people like sports events, concerts, festivals, etc. A lot of the things that you see that have been getting canceled, like the NCAA, NASCAR events, all different sporting events, across the world are being canceled or delayed. But that also means not going into restaurants, food courts, large shopping areas. And so just kind of think of other ways that you might be able to get some of the services that you need to try to avoid those situations. So if you do need to get any of those things, using a drive-through for the restaurant, doing grocery home delivery or curbside pickup services rather than actually going into the store or the restaurant itself. Other parts of life, too, where this can affect you, so it means not attending church services and then maybe attending the service virtually. If you have kids, you've probably seen that some of the schools have been canceled, or kids are placed on homeschooling. Maybe the child care, youth centers are closing. That might mean that you may not be able to do play dates, with different families. So as an example, if you have one set of kids that play with your kids, that might be okay. If you have anybody where either you or that other family interacts with another large number of families, then you're spreading it amongst yourselves. So I know that having the daycares and the schools canceled poses a big challenge where families, where both parents work, and maybe both of them are required to be at their jobs. So just really trying to think about different ways that you might be able to address that, and possibly pairing with another family in the similar situation, and then sharing the daycare responsibilities where each parent takes off at least one day off through the week. In the workplace, you'll see that it means using a liberal use of telework, using VTC instead of attending a meeting in person, maintaining your spacing. That's something that we're actually doing here in the headquarters at TRADOC, where if we have any meetings that need to be done, we actually, even within the building, we set up VTC, within different rooms, within the facility, and anything that we have to do with any of the, the HQDA, the headquarters for the Department of Army too. Instead of all of us congregating in one conference room, we'll actually are spread out throughout the building too. So all of our attendees are throughout the facility as well. Other things, in your individual workspace, you may do shift work, maybe separating personnel into fully functional cells, just for redundancy, limiting some non-mission essential personnel actually even coming to work. And again, as I mentioned, setting up the telework capabilities at your facility. If you do have some commonly used surfaces, making sure that you're wiping down those pretty frequently. And if you are curious too, the CDC does have some recommendations on cleaning the workplace so that way you know what it is that you need to do and the types of cleaning materials that you should do. So with that, just to kind of just amplify it, social distancing works. It only works, though, if everybody does their parts and follows the guidance, that it's being given to you. So just a couple of different analogies. I mean, if you think about a tug of war, if everybody on the rope isn't doing their part too, the whole team's going to fail. The other thing too, and again, you can probably tell that I have small kids, but if you think about the Disney Pixar movie Finding Nemo, when all the fish are caught in the net, the only way they're able to get free is that everybody swims together. If you need any historical reference, for the historians that might be in the audience, if you look at the influenza pandemic in 1918, look at the two differences in the cities of St. Louis and Philadelphia. So Philadelphia did not practice social distancing, and they continued with some large social gatherings within the city. And then they had huge numbers of people that died from the flu. St. Louis, on the other hand, the government there really implemented the social distancing, canceled events like you see what's happening right now in the United States, and they had minimal impact to their population. The reason why that's so important is the impacts of a rush on a service. And so I won't take credit for this because I did see it on social media, but I think that really amplifies this in a way that people can probably already visualize. So if you look at what happened in the grocery stores all around you, so people are grabbing up toilet paper, hand sanitizer, cleaning supplies, you name it, all the different foods, that people might need, to kind of hold on to be holed up in their homes for a while. Now think of that and apply that to what is going to happen in our medical system, where you have a finite number of ICU beds, ventilators, medical staff, and so on. And if everybody's doing a bum rush on the system, and there's nothing else available too, everybody else that's coming on that's later too, there's nothing available for those people to use. So what happened in the stores is what's going to happen into our hospitals. The only way that we can really help to keep that from happening is if we do our social distancing, limit the number of people and the rate of rise of number of cases that we have, limiting our contact with one another too, and that'll keep that system from getting flooded, one large chunk. We'll be able to manage everything sufficiently. So remember too, you might get reports about the number of ventilators that we have in the United States, and people think, oh, okay, I think it's about 70,000 in the U.S. But you also have to remember all of those medical services are needed for care for people, things that were going on before COVID came around. So heart disease, lung disease, people on dialysis, anything else that really put anybody into the ICU, that still is occurring right now too. So it's really important that we don't have this mass rush on our systems.
So, Colonel, you mentioned the importance of social distancing. You made that abundantly clear, as well as the burden that can be placed on medical services if we don't adhere to that. So what advice do you have for people who need routine care like annual checkups or even elective surgeries?
No, it's really important to know that. So right now, if you are feeling well and this is the time of year when you would typically go in to get your annual visit, maybe a mammogram, maybe get your just routine screening. This might not be the time to do it. So just kind of consider postponing that for maybe 1 or 2 months until this wave kind of passes us, and still address those things too. And I don't want you to forget about it completely, because it is extremely important that we get our routine care done. But right now, if you come in, you're potentially exposing yourself to others that might be sick, and the nurses, physicians, everybody is really trying to focus attention on this particular illness and making sure that people who are coming in are staying well, and that if we can hold off on that too, then don't come in for those particular visits. Obviously, if you are sick, again, there are other things that go on besides just having the COVID, and so you do need to notify your medical office, wherever it is that you seek care. But if for any of the routine type of things too, say for calling in and getting medication refills, I'm pretty sure that your providers will be more than willing to do that through the telephone, as opposed to having you physically come in for a visit right now.
Sir, are there any new developments or any new information that's come out about COVID-19 recently that you'd like to share?
Yes. So there are a couple things too. I know that the researchers are still trying to come up with some ideas about this disease too. And because again, this is a novel virus. There's some differences amongst it. There's one thing as far as for the treatment, for the symptomatic treatment. This is coming from France. Now, this is just a report, from the providers that are there. And they've noted that people who are using steroids, it seems to worsen the COVID illness. And they also postulated or think that it might be the same problem that happens with a medication class called NSAIDs. So that's ibuprofen, like naproxen, naproxen, those types of medication. Now, this is not a great study, and really this is only just an observation from all the clinicians that are there too. But if you have a fever and you have acetaminophen, commonly uses the trade name of Tylenol, they didn't seem to have the same sort of worsening of symptoms with that particular medication. Again, this is not a great case study. This isn't fully supported, but it's one of the observations that they had at their location, and they put out that recommendation to everybody. One other thing, too, is that why is it that the older population seems to be affected by this more so than kids? One of the thoughts is that the COVID virus itself, I don't want to get too much into the science on this too, but there's a receptor that's in your body called an ACE receptor, and that is more prevalent in adults and older folks, and it's not very prevalent at all in kids. And it seems that that's where the COVID virus actually attaches on people, is on these ACE receptors within your body too, and so that might be why we see minimal symptoms. Now that being said too, kids still do get sick with this, and there are some kids that have gotten pretty ill. But for the most part, the majority of them, they'll typically have milder to moderate symptoms, as opposed to older adults who get really impacted, by this disease, like we saw before.
Colonel, do you have any last words or any advice before we let you go?
No. The biggest thing is just I can't emphasize the fact more about following the guidance for the social distancing. I mean, that this really takes everybody's effort. You can't think that that doesn't really necessarily apply to me. This is everybody's doing their part, and then you're going to see this be extremely successful. If we see people only minimally doing this, then it's going to, all of the cancellations that have been going on for all of these different events, that'd be for nothing, and we're going to have this huge wave that hits us. So just please ask everybody to follow that guidance on the social distancing, and we'll be able to get through this all together.
Colonel Meyering, I want to thank you for coming on, and thank you for relaying this important information. And I'd like to thank everyone for listening to this episode of TRADOC Talks. Colonel Meyering, thank you for being on.
Yeah, thank you very much. Appreciate it.